Hi, my name is Carl Zimmer. The Guilford Free Library has asked me to talk to you about COVID-19 and what it means for our library and for our community in Guilford, Connecticut. I'm speaking to you as a member of the library board and also as a science writer. I'm a columnist for the New York Times and I've written a number of books about science. And right now, COVID-19 is taking up a lot of my time for my reporting. COVID-19 is caused by a virus known as a coronavirus. It arose in China in late 2019, and the movement of people brought it to other countries in early 2020. In the United States, we did not start following its spread in January because we had very few tests at the time. The surge of confirmed cases now is partly the result of increased testing. It's also the result of the virus spreading rapidly. The coronavirus infects the airway. You can get infected by breathing it through your nose or mouth, or by getting the virus on your hands and then touching your face. It's pretty contagious, meaning that each infected person may infect an average of 2 or 3 people if no measures are put in place to stop its spread. It is wrong to think of COVID-19 as just a cold or just a flu. It is roughly 10 times more lethal than seasonal flu. In the worst case, damage to the lungs requires a ventilator to give people a chance to survive. Other people will need to stay in the hospital to get a supply of oxygen. Other people will get bacterial pneumonia that will require antibiotics. People who have suffered through COVID-19 at home have described terrible fevers, body aches, weakness, and dehydration. Some people who get infected will be luckier. They will feel sick for a few days and then recover. Some may just feel under the weather. But that is no reason to treat the virus as just another sickness. If you get infected, you can spread it to others, especially the people you live with. Protect your family and others. You need to stay healthy. Right now, there is no drug proven to be effective at killing the virus. There is no vaccine. Scientists are working as hard as they can towards both these goals. We might have antivirals in a few months. We might have a vaccine in a year. In Connecticut, the first positive test for COVID-19 arrived on March 11th. As of March 24th, there were 618 confirmed cases in the state. And it's likely there are many more because it's not yet possible to test enough people to know. There are 71 hospitalized cases and 12 deaths. Guilford currently has 4 cases. It is almost certain that there are many more cases in our state because we don't have enough tests yet to know how widespread it is. In Connecticut, as in many other states, the number of confirmed cases has risen exponentially. So even if it seems like relatively few people are sick, that will change, and it will change fast unless we do something. One of the biggest threats posed by this explosion is that it may overwhelm our hospitals. Healthcare workers have a limited number of ventilators for the most serious cases. They have a limited amount of protective gear. If they get sick, they can't help patients. We have to do everything we can at this moment to reduce the surge of sick people that they need to care for. That will make a big difference to how many people survive. Cleaning your hands and not touching your face is crucial. Soaping your hands for 20 seconds literally tears the virus apart. Wash your hands every time you come home, before you prepare and eat food, or after using the bathroom. Just as important is to stay 6 feet away from people outside your home and to stay at home except for the bare essentials. That is hard for everyone and harder for the vulnerable. But together we can slow the spread. Imagine you were infected without realizing it. If you pay a friend a visit and just sit across the table a couple feet apart, you may breathe viruses on that person. That person could get infected. And then they might infect 2 or 3 people, and so on. It doesn't take very many transitions for you to infect thousands of people. But if you skip the visit, give the friend a call from home instead, all those people are spared. The American College of Emergency Physicians made this point clear in a recent statement. Stay home and save lives. This is why the Guilford Library is closed. We do not want the library to be a place where more people become infected or to start a chain of infections that stretches throughout our town and beyond. To that end, the library will not provide curbside services in order to protect both patrons and staff. The library has many offerings that you can access online if you go to guilfordfreelibrary.org. You can also call 203-654-9844 for reference service questions from 10 a.m. to 6 p.m. Monday through Friday. Getting good information during these trying times is very important. I have seen friends and family sharing emails that are supposedly from a friend of a friend of a friend whose friend is an expert on COVID-19 in Taiwan. The tips they give you are bogus. They're fake. Holding your breath for 10 seconds is not going to tell you whether you have COVID-19 or not. And these fake messages may lead people to make the wrong decisions about their health. So please stick with what the public health experts have to say. The state of Connecticut has a special site at ct.gov/coronavirus. Yale Health has a COVID-19 page. The Centers for Disease Control also has information about the virus and how to protect yourself and your family. I will also post links to good sources of information in the notes to this video on YouTube. Thank you for your time and stay healthy.